You're live.
Okay, well, good morning, everyone. My name is Captain Milton Troy. I am the Chief of Staff here at NAVC headquarters located at the Washington Navy Yard. And today we have with us definitely an expert as relates to COVID-19 as well as the vaccinations. And that's Commander Tracy Krause, who is the OIC at the Navy Branch Health Clinic in the Washington Navy Yard. Before we begin, I would like to set some ground rules. Today, we're here to keep the focus on, our questions focused on medical scientific questions as it relates to COVID and the vaccinations, though. We're not here to truly address anything as it relates to policies or anything like that, though, but strictly to the science, what those, questions that many of you have been asking about. And so we figured we'd bring a resident expert in order to do that, though. We're going to try our very best to get through as many questions as possible, but we are keeping a log of all the questions that are coming in. Right now, we're up to 16. So we'll definitely make sure that every question is logged, and if we don't get to it today, it will be answered and will be distributed out to the masses, though. All right. Before we turn it over to Commander Krause, I would like to give a brief introduction as far as from a bio perspective. She's originally from Asheville, North Carolina, where she received her Bachelor's of Science in Nursing from Winston-Salem State University, in 2003. A few things about her career. She got her master's degree in public health from Johns Hopkins Bloomberg School of Public Health, with her concentration in infectious disease. Again, we definitely have an expert as far as what we're here to talk about today. She completed her doctorate in nursing from Johns Hopkins School of Nursing in 2016. And she's also done some work in El Salvador.
Yes.
Yes, so where she did some disaster response, medical things going on down there as well, too, though. So she brings with to the discussion today a worldly and scholarly level of experience to be able to address your questions today. So, Dr. Krause, thank you for showing up today.
Yeah, thank you for having me.
Absolutely. So I guess we'll start. I had some pre-questions, but there's enough here to get started. So let's start with, hey, does the COVID-19 vaccine prevent transmission of the virus?
So that's a great question. So it does not prevent the transmission of the virus. Back when COVID first came around and we were starting to see the base in particular go to Charlie, that particular strain, when we vaccinated with Pfizer and Moderna, had about a 94% efficacy between the two of them. One was 94.5 at the time, that was Pfizer. And so the likelihood of you passing that particular strain of COVID was like 0.001%. So we felt pretty confident in giving the vaccine. So we gave that vaccine. We still told you that you could still pass COVID and get COVID, but the likelihood was very, very low. Well, as people didn't get vaccinated, this strain mutated. And even the first few mutations, we didn't even see an increase or spike in numbers. It wasn't until we got to Delta that we really started to see that. So Delta is the one that is super contagious, easy to spread, easy to get, but those who get it likely won't show signs and symptoms. And if they do, it's minor. It's cold symptoms, sinus congestion, and headache. It's those that are unvaccinated that will have those serious complications.
Okay, thank you. Okay, so here's another question. This one is, it says, I'm receiving my Pfizer dose in a few days. What preparations should I take prior to receiving my first dose of this vaccine? Is there anything I should avoid for the next few days or plan for the days following?
Sure. So even up to your vaccination date or when you get your vaccination, there's nothing that you have to do right? Like we tell people to not go out and drink heavily the night before just so they're not dehydrated, right? But we say that with any kind of vaccine that you get so that you continue to feel good and don't think that it's a sign of the vaccine itself. So when you get your vaccine, if you don't want to have a sore arm, you can take Tylenol, Motrin, whatever you normally take for pain. The first dose isn't really bad. You'll have that sore arm and feel like somebody punched you on the arm, but that's usually about it. Some people will have a headache unless you've had COVID before. If you've had a COVID before, you do have some antibodies there, and it could boost off of that and cause you to have a little bit of a stronger reaction, which is what people typically see with the second dose, which is some of those flu-like symptoms that typically last 6 to 10 hours. But for those, you can take Tylenol, Motrin. Chicken noodle soup is a great home remedy that Grandma put out there. So those are the things. Otherwise, you really don't have to do anything. Just come in and be prepared to get it.
Okay, thank you. Okay, so this one is kind of long. It says there are currently approximately 23 young men serving our country that have developed
Myocarditis. Yeah.
Fatality rate of approximately 50% within 5 years, according to some medical sources. How does that compare to the total fatalities from the virus within the service?
Sure. So myocarditis has typically been seen in young men. There's an age range. I want to say it was 18 to 27, if I remember correctly, but I'll get that number for you and I'll send it back to Captain Troy. None of those people in the service that got myocarditis have died from that. As far as what's out in the public, I haven't tracked the public rates of people who have died from myocarditis, but the information that we're reading on myocarditis is they're treatable in young, healthy populations, right? They're in the hospital less than a day, even if they're hospitalized, and then they're feeling better and back out there. The death rate of those unvaccinated is significantly higher.
Okay. Let's see. Here's another question. What is the mathematical definition of safe and effective?
So that's really hard to put into math terms, right? So safe and effective, we want to be able to give you something and the force within itself so that we will have a ready fighting force, right? So we got to keep everybody feeling good. So as I said earlier, people who are getting vaccinated are only having cold-like symptoms. Before, back when vaccines were not available, we were having people hospitalized sometimes 30, 60 days, and then they're coming out and they're needing transplants to have working lungs, and then they're no longer able to be in that fighting force, and we're having to put them out. So that's what we're looking for. What is safe? What's going to cause the least amount of harm and for the greater good?
Okay, here's another one. Is there a list of conditions, previous experiences, i.e. allergic reaction to a different vaccine that would qualify for an exemption?
So great question, right? So if you've had an allergic reaction where it's required epi and you've been hospitalized and that's documented in your record, then that's a great starting point. So if you just received Benadryl because you had a rash, honestly, that's not going to qualify you for an exemption on the medical side. We usually don't even route that paperwork up. But for instance, I had a patient that came in yesterday that he got it out in town. He had an allergic reaction. He had to go to the hospital. His face was all swollen. He has pictures, great documentation. He definitely had a severe reaction. He would qualify for a medical exemption. So we're looking for that prior documentation to see if we have enough evidence to support routing it up. He himself will still have to go see like dermatology and things like that because we want to make sure it was that vaccine that he had a problem with.
Okay, here's another question.
Sure.
What are the long-term 5-year plus effects of COVID-19 vaccines?
So we don't know what's going to happen 5 years from now. As you can see, as the vaccine comes out, they continue to study it, continue to check the efficacy, the antibodies and things like that to see where we are, to see if you're going to need to get a booster. So Pfizer just came out with their booster, and it's going to continue to be researched. So it is relatively new, but they have done some in-depth studies where the N or the number in the study was extremely high and looked at those side effects. And that's what we have now. And that's what we're basing our research on. But I think you'll see it continue to grow. Hopefully we stop the mutation so it doesn't become a yearly booster like the flu as the strains change.
Okay. Let's see. Can you shed some light on why someone who has had COVID antibodies and is in their 20s would benefit from the vaccine, considering the extremely low likelihood of their hospitalization, which is the only protection the vaccination will give them, won't necessarily prevent infection?
Sure. So that's a great question. So the thing with antibodies is not everybody who has COVID develops antibodies, and they wane at different times. So that would be something that we'd have to check on an ongoing basis. And in some jobs, if you're out at sea, we can't check that, right? We need a special lab to be able to go in and check that regularly. And the COVID vaccine hasn't shown to hurt anybody who has those COVID antibodies. So antibodies themselves, typically, if you get them, and again, some people don't produce any antibodies, especially if they end up being hospitalized, right? Their body's just not producing them. So then that wouldn't work for you. So it's better to go ahead and vaccinate. As far as someone being young and healthy, I've seen young and healthy people end up in the ICU and on ventilators. So it can happen. COVID doesn't discriminate. It doesn't care if you're old or young, healthy, not healthy. It's there, right? So it doesn't care if you're healthy. So that's a bad decision to base it on, because you could be the healthiest person and still get it and end up in the hospital.
Okay. Let's see. The insert in the Pfizer shot states there is no data on the effects of breastfeeding. Why is the FDA stating this is safe for lactating mothers?
There is no, effects of breastfeeding. Why is FDA stating that So we reached out to OB providers. So we give it at the clinic, and we had fertility experts come in. We had OBGYNs come in, and they have not said not to give it to pregnant mothers. As a matter of fact, we've had babies born from pregnant mothers who have had it and who are breastfeeding that are showing an immune response. And we've had mothers who didn't get vaccinated who have given birth, and their babies have actually gotten COVID in the hospital because it's so easily transmitted. Even if you take all the precautions, it's just not a guarantee. So it's not shown to hurt babies, and it's a lower dose because they're receiving it through the breast milk. But just like you're passing on your other antibodies to them, it's a good thing.
Okay. Let's see. Is natural immunity from getting COVID-19 more or less effective than the vaccine?
It's less effective because we don't know how long it will last or when it will be. So once you get that vaccine, even though you can get and transmit it, it's harder, right? Unless it's that Delta variant, then your viral load shouldn't get high enough to pass it, which goes back to that lower 0.001% of that COVID strand, that initial one that came out. So the more people that we get vaccinated, if we keep it from passing, then it won't mutate, and that even lowers your risk. And you need a high viral load to be able to pass it. So vaccinated people, it takes more of it to give you a high viral load, which is why you only have small signs and symptoms.
Okay. Okay, let me see. I'm trying to find. Okay. Okay, can you please advise the approved legal status of any vaccine and if it's experimental? Not quite sure.
So I'm not sure what you mean by experimental. So right now, Pfizer, Moderna, and J&J are in the U.S. and have EUA approval, so emergency authorization use, so they can be given. And then Pfizer has FDA approval for camaraderie, which they have said is the same thing as Pfizer, and it was made that way, that name changed, because Pfizer has two different age groups. So one is still under EUA, which is your 15 or your 12 to 15, and then 16, I believe, and up is the one that's the camaraderie, so FDA approved. There's still several. AstraZeneca is out there. They're mainly given overseas and in Europe yet. It hasn't hit the United States. There's a laundry list of them out there that are not considered experimental yet. They're just being used under the Emergency Authorization Act, and they have pushed to get those actually FDA approved. Moderna has theirs in, J&J has theirs in, and they're also applying for boosters. So if you'll see, Moderna just got a booster approved for EUA, and then they'll fight to get that FDA approved too, but there's certain steps and they have to take them in order.
Okay. Actually, I'm pulling some questions that we got yesterday from email.
Okay.
If the vaccine works, why are we still wearing masks that have negative effect on our oxygen intake?
So that's a great question, and it kind of resembles another question that I got. So I'm going to kind of loop them together just so I can give you the feedback and answer it. So we're still wearing masks for a couple of reasons, right? So again, We didn't. We started vaccinating. We said people could take off their masks, but we saw those rates jump. And what we found was that we ourselves are protected and we might get COVID and just have those simple things, but a lot of our families aren't vaccinated. We have younger children that still go to school or daycare, and they tend to have pick up the virus, whether it be the Delta variant or the COVID variant, and they get it. And so then they pass it to us, and then we were passing it to our coworkers. They're taking it home to their family. So while we at work really aren't sick and we might just have a headache or sniffles, which is why the instruction changed, right? So I'm vaccinated, but if I test positive and I'm not symptomatic, I still have to work. I just have to wear my mask because you can't pass it if both people are wearing their masks. You have to be wearing your mask appropriately, the right way, and it has to be the right kind of mask, but you're not passing it. So that's why we're still wearing masks. You're not going to take it home to your family. You're not going to give it to someone else to take home to their family, because no one knows what, I don't know what Captain Troy does when he leaves here and if his family's vaccinated, and he doesn't know if my family is vaccinated. And we don't know what people were doing on the weekends. And there was a lot of misinformation out there saying if you're vaccinated, you could pretty much do whatever you want, right? So we had people going to rallies and concerts and, being in this large closed area. And it says if you're vaccinated, don't wear your mask. Well, not everybody follows the rules. We had plenty of people who were not vaccinated that were still going without their masks. So that's where we're seeing that spread. As far as low oxygen rates, we have seen very, very few. So people who have emphysema or COPD, it is harder for those people to wear the mask, and we can work with them to try to find some medically different alternatives to the mask. But normal, everyday, healthy people, we put O2 monitors on their fingers and have them walk, and we weren't seeing that oxygen drop rate.
Okay. Let's see. So here's one. My daughter had cancer and is advised not to get the vaccine. I heard about monoclonal antibodies, being given instead. Do you see that being offered anytime soon?
So I'm going to be really honest with you. I have not seen that being offered in the military. That doesn't mean that it's not happening at a base around here. So once I have somebody who gets COVID, they're transported, or if they're going to be hospitalized, it's either Fort Belvoir or Walter Reed they're typically sent to. And then the people that are immunocompromised, as in our cancer patients, we typically have them go through the hospital setting so they can monitor them for side effects and talk about if they need to do anything different.
Okay. How common are breakthrough infections?
Sure. So recently we've seen a pretty high rate of breakthrough infections, but not as high as just regular COVID infections in the unvaccinated population. So just base-wide. So I'll talk about just what we see here on base. I would say in the last 3 months, and for me, I'm going to be honest, any number above 1 is high. We've had probably 27, and that's for everybody I see at the clinic. Right, so they're coming in, they're vaccinated, they're not complaining of symptoms, but somebody in their household is positive, and we'll test them. And because they had that long period of exposure, they're getting that breakthrough infection.
Okay. Let's see. A lot of these questions I think you've kind of addressed.
Sure. Yep.
Let's see. Okay, I'm not quite sure about this one. It says I guess you can confidently say that the unvaccinated cause the mutation.
Can I confidently say that?
Yeah,
sure.
Yeah.
I can answer that question. So in my experience and what I've learned through school education, being on committees and reading research papers, I honestly believe that is the biggest cause, is the unvaccinated. And that doesn't mean the unvaccinated that are eligible. That means everybody from our children across the board, right? So children, adults, all that mixture. And it's proven in science that that's how viruses mutate.
Okay. Let's see. How can the Delta variant be confirmed so no test for it, if it even exists, as no official test for this variant has even been approved? Is that true?
That is not true, actually.
Okay.
So the military does have the capability to genotype the viruses, and there is actually the Navy Marine Corps Public Health Center takes swabs. So we swab everybody to confirm if you're negative or positive, and they take a percentage of those swabs and we run it and genotype it to figure out the variant.
Okay. Let's see. How are the strains of COVID determined? Did the test specify which variant you have?
So no, the test is going to tell you if it's negative or positive. It's those genotyping of the strains that we're looking at that will tell us the variant. And it's not done on every single one. It's a population pool.
Okay. Let's see. Is there an isolated sample of COVID-19 for researchers to study? Apparently, there were several universities requesting an isolated sample, and the CDC cannot supply that.
So I'm going to be really honest. I don't have the answer to that question. I'm happy to reach out and see if I can get that one for you. So if you can flag that one.
Yep.
And I'll get back to Captain Troy on that one.
Okay. Let's see. Many of us received the J&J shot via Navy medicine overseas. We have received significantly less information compared to other shots. Should we anticipate the need for a booster shot? Can we mix with other mRNA type shots?
So yes, if you receive the J&J shot, you can mix with the other mRNA vaccines. They work two separate ways. J&J is not an mRNA vaccine. And then you should be getting information about J&J's booster. They've applied for a booster to come out under EUA. It has not been approved yet for emergency use. So stand by for that if that's what you want to do, but it's not uncommon for us to have someone come in that received J&J. It's been 6 months and they want to start the series of either Moderna or Pfizer.
Okay. Let's see. Is the vaccine made to protect against the Delta variant and future variants?
So it does cover the majority of the variants, but it's still, no matter what vaccine you get, it's not going to say that you can't ever pass it or get it. The more people vaccinated makes it harder for it to mutate into something that we haven't studied yet. So that's why that's there, but it is covering the variants. So if you're vaccinated, you're not going to be severely ill or end up in the hospital. The only people vaccinated that are ending up in the hospital are elderly patients that have comorbidities, whether it be COPD, which is something that already affects their lungs. Let me see what else. There's a couple other conditions that elderly can have when they have a bunch of those stacked all together that puts them at risk to really get any disease.
Okay. If someone has had a confirmed case of COVID, would the natural immunity be higher than with only the COVID vaccine?
No, I think we kind of touched on that one earlier, right? So we don't know how long your immunity would last. Typically, they're saying 3 months, but that's not a guarantee because not everybody produced the antibodies. And then it would be an ongoing test to try to see when your antibodies started to wane.
Okay. Are all of the vaccines equal in efficacy from person to person and shot to shot?
No. So Pfizer started out, I want to say it was like 94.5 and Moderna was at 94. So everybody's like, get Pfizer, which is still a good vaccine, but it is shown that after about 8 months, it wanes to about 89%. And then that's why they have gotten the authorization for the booster. So 89% is still good for again, your relatively healthy people who are taking precautions. But they're saying the booster for your 65 and older because they typically have a lot of diseases or comorbidities that put them at risk for those complications. And then those that are working in frontline jobs or going to be in contact with a lot of people. So healthcare workers, as an example, are being urged to go ahead and get that vaccine booster because you come in contact with so many people. You want to have that 94%. Moderna is still holding high around 95, and J&J is a little lower. It was, I want to say 86 the last time I checked, so a little lower than Pfizer and Moderna.
Okay. Can you please provide the details and assurances that vaccines has been fully, independently, and rigorously tested against control groups and the subsequent outcomes of those tests?
So I can send Captain Troy a list of like research articles and things that show where it was tested. It does go in front of the ACIP and then the FDA for approval and for use. So we can get you those resources that show that it's been tested. It's going to be continued studies for many more generations to come, right? It's going to be an ongoing thing now that we know it's here, kind of like with polio and mumps and measles. At one time it was eradicated, and you can see that you still get breakup cases every once in a while, and we're still studying it.
Okay. Does the COVID vaccine cause a blood sugar spike in diabetics?
I have not seen any research that says that it causes spikes in diabetes, and that's not a disqualifier to get the vaccine.
Okay. All right. I think we answered that one as well. Okay. Are there any concerns with COVID-19 vaccines and G6PD deficiency?
So I'm going to be really honest with you. I'm not sure about that deficiency. So I'll write that question down and take it back to, and I'll get you an answer on that one.
Okay. Okay. Why does the virus mutate, and what is the mechanism used in mutation?
Oh my, okay, that's really sciencey. So it continues to mutate kind of as it grows, right? So kind of like when you get mold on something, right? It starts out your food is fine, but after it sits there for a while, it continues to fester and grow. So to put it kind of in layman's terms, that's what that virus is doing. It's spread from person to person and mixing, and it's going to continue to mutate into a different strain. Just like with the flu, we have a different strain every year, and it comes out the results like, you know, this particular flu vaccine has this much efficacy over the strain that's out this year, but it's different from last year. So we always study it, and it's studied the same way we're studying the swabs for COVID. It's a continuous process to try to see if we can stop it. I think Lambda's out there for the COVID virus, and Lambda they thought was going to be a problem, but people started getting vaccinating, so it's not as easily spread. So that's where we're looking to stop the spread.
Okay. Let's see. One, I think, what is the actual R not of the Delta variant?
So what is the actual R of not of I would have to look up that number and get back to you, but I'm happy to look it up and provide that data.
Okay. Let's see. Oh, the questions are definitely coming in.
That's okay.
All right. I'm just trying to scroll through to make sure we're sticking with the science of these questions. Let's see. Okay, I have had Guillain-Barré syndrome and currently have, is this psoriasis?
Yep.
Okay.
Psoriasis.
Psoriasis, and I'm not supposed to have flu vaccines or COVID vaccines due to reactions. What is your advice?
So my advice is that you talk to your PCM and take the medical waiver in and have them go over it with you. You definitely should talk to your provider before you get the vaccine. They can recommend if there's anything that we can do to pre-treat that, but if you do have that, that is one of the conditions in which we look at.
Okay. Okay. Actually, let's go over here. What is the justification for making people? Well, actually, I think we kind of addressed that too.
We did that.
Yeah.
Can I talk about what we've seen in the clinic?
Please.
Yeah. So while people are still typing questions and Captain Troy's talking about it, so when the clinic first started vaccinating, we started giving Moderna because we didn't have a freezer that could hold Pfizer at the temperatures in which it needed to be stored. So when we started giving Moderna right around the 8,000 mark, up until that point, we had no reactions at all, minus people coming back saying they had a sore arm. And then I had a lot come in, and I had 10 people that needed Benadryl out of one lot. So we immediately sent that information into VAERS, and we were able to put a hold on that lot and not give it. We didn't have much left. We still had hundreds of people get it that had no reaction at all. And when I say reaction, they had a rash on one arm and it went across their chest, but I had 10 back to back to back to back. So there's a lot of things that look into it. They send you questionnaires like, did we hit a blood vessel? Did we do anything wrong? Is it the same person that vaccinated everybody? So those 10 people received Benadryl. Other than that, we haven't had to give Benadryl. We've never given epi at the clinic for a vaccine reaction. I did transport one. That person said that they felt dizzy. They stood up really quickly, and I don't know if you know what a vasoresponse is, but if you stand up too quickly, you can get dizzy. He got dizzy, he fell, he hit his head. He ended up having to get stitches where he lacked his head because he hit it on the chair. Again, it was a vasoresponse. I did have a young gentleman that passed out. When he came to, he said he forgot to tell us that he passes out with all vaccines. It was a good giggle then at the clinic because we realized that it wasn't anything serious, but we initially thought it was. He has since gotten his second dose. He had no problems because we put him in a recliner. So if you have any kind of problem like that, make sure you tell us ahead of time. We're happy to put you in a recliner, prop your feet up in the air, give you the vaccine, and let you hang out with us a little bit longer. So we're up to about 14,000 now with Moderna, and we haven't had any other reactions. We've given them in the clinic. We've given them at the conference center. We've done some shot X's. And we always have Epi and Benadryl and stuff standing by. So that first dose, like I said, we've really only seen sore arms. We've had a few people that have had some headaches and fatigue. We track the signs and symptoms and side effects with the VIIRS reporting system. And then with that second dose, I would say about a third of our population has flu-like symptoms lasting anywhere from 6 to 10 hours, but all are recovered within 24 and back to work. We had 2 cases. One person was somebody who was on arthritic medicine that afterwards, after his first dose, went and talked to his doctor and he had him stop his medicine before getting a second dose just because he felt a little bit ill. We did have a person who was on thyroid medicine that had some issues. She talked to her provider. Again, nothing that required hospitalization, but just felt ill. And that is truly being transparent and telling you everything that I saw at the clinic. With Pfizer, we just got it in, I would say maybe 2 months ago to give at the clinic. We can store it for 30 days in the refrigerators that we have. After that, we have to discard it. We have discarded some that is not used. We've had no reactions to first or second doses with our Pfizer minus that sore arm and headache. We're vaccinating Monday through Thursday with Pfizer, and then on Friday, we're given Moderna. We are doing boosters for those who qualify. So that's kind of what we've seen at the clinic as far as reactions, true, like can see, put your hands on type reactions. At worst, we've given Benadryl. We have stuff to give more if we've needed it, but we haven't seen it and we haven't needed it.
Okay. Let's see. I guess it's a follow-on to a question earlier. It says, you have stated how the unvaccinated are more at risk over and over again. Can you expound on that? Medically speaking, not simply what may be opinion, I have had COVID and my only symptom was a headache. I did not miss any work.
I would say you were one of the lucky people that you only had that. The problem is, so medically speaking, you may have only had a headache, but let's say you get COVID again and it's worse, or you spread it to somebody and you may have only had a headache when you had it, but if anybody else got it around you, they might not simply have a headache and they could have a worse reaction or worse die from it. So we're trying to prevent that. So it's not just about you, the person, but it's all the people that you work with and come in contact with, whether you're out in public or your family or those that you work with.
Okay. Let's see. All right. Getting emails. Get out of the way. Okay. I think we kind of covered, like, another question. Can you please advise of the adverse reactions associated with this vaccine since its introduction? I think you kind of covered
I hope I covered that one when I add them, but if you have questions that are, very specific, you want to know about a reaction, if you send them to Captain Troy, he can forward them to me at the clinic. I'm happy to answer each one individually and talk about it. I am happy to talk about vaccine. I like the science. I like talking about it, and we can pull up articles and go over them. There are a lot of bad articles out there. So we really dig into them. Let's look at the end. Let's look and see where the research was done and how many people participated in the study.
Okay. Let's see. All right. Okay, if we reduce antibodies, why is that an exception?
I think we kind of touched on that, right? So we don't know how long those antibodies are going to last.
Right. Let's see. Oh, well, someone just asked, how long does the vaccine last?
So again, so you'll see that it's still being studied, right? Because it was a newer vaccine. So they tested it and did the study on those people, and they're still following those individuals that are part of that initial study. So as their vaccines begin to wane, which in Pfizer, they're seeing that, that's why they offered the booster. So we'll continue to see it studied, again, many years to come, and that's how we'll know if we'll end up needing boosters.
Okay. 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 Okay, I think we can answer this one as well as far as getting a booster shot. I'm receiving my booster shot tomorrow, and I was wondering if I should expect to see the same if I decided. Okay, this is a different question.
Yep.
Okay, I'm receiving my booster shot tomorrow, and I was wondering if I should expect the same effects as my first 2 shots.
Sure. So the side effects of the booster shot has been about the side effects of the second shot.
Okay. Is getting the booster shot recommended for young people? The CDC guidance sounded very lukewarm when I read them.
So right now, we really haven't seen a booster shot required for young people unless you're immunocompromised, and then we definitely talk to your physician before we give it. So that 65 and older and our frontline workers, that's where we're looking.
Okay. What is your medical opinion for an older individual with known documented heart issues to seek an exemption?
So exemptions start with your primary care provider because they have all of your documentation on your whole medical history so that they can review that. So if you truly have a heart condition and it falls in line with that, I urge you to talk to your primary care doctor and have them fill out the paperwork, and those will be routed up and they're being looked at by the top doctors in the Navy when they're reviewing those, and they can attach everything on there. But it is a true heart condition, not I ran fast after my PRT and I ended up getting an EKG done. Because we've seen some of those, right? Because they're like, well, I had a heart condition at one time. But if you have that documented information, and that's why your primary care provider is so very important, not just any doctor, right? You need to get in and see your regular doctor that you see on a regular basis.
Okay. Okay, this is a question I know I've heard a lot is it safe to have the influenza vaccine at the same time a dose of COVID-19?
Yes. Yes. And we have all that paperwork printed and available for you to read at the clinic if you come in, but you can definitely Google it if you want to. Not that I advise to Google because so many other things pop up, but we keep copies of it and we can do both at the same time.
Okay. Just see. All right.
Sure. So why not just say?
I'm sorry.
Yeah.
Yeah.
No.
Yeah. Why not just say
Variant
variant
X?
X? No, go ahead.
So sure. So I mean, we could talk about each variant individually and tell you that we really didn't see them. Delta is the one that we've worried about the most because it was the most easily spreadable and contractable. But you're right. In terms, we could sit here and list them all out, and I'm happy to send that to Captain Troy as well and let you know where it was seen, where it was found, because they track it all over the U.S. Some were only found in Africa, others were only found in Europe, and then we've got a handful that have been found in the U.S.
All right. I'm going to paraphrase this though, because so for women, as far as pregnant, I think we kind of addressed that though, as far as vaccinations though. I mean, can you kind of,
Sure.
just kind of amplify as far as, risk if they're already risk or anything like that?
So no, pregnant women are being urged to get the vaccine, right? I always talk to my pregnant women and we tell them, have you talked it over with your provider? Do you have any outstanding questions? We do have OBs that we can call. We're happy to call your OB too and get them on the phone just so that you can hear it from your doctor as well as ours so that we can address any concerns that you have. But we've seen no negative outcomes. I have a handful of staff that are pregnant that have been vaccinated and happy to share that with you. And we had a staff member whose wife was and again, she shares it, so I don't feel like I'm doing anything because we have had big talks and get-togethers kind of like this. So we had a member whose wife was not vaccinated, and her and the baby got COVID. So they wish they got the vaccine, right? So, but you wish you get it after you get COVID and you're really sick. So it can be a scary thing. But we're happy to get your OB on the phone. We're happy to call an OB so that you feel like you're hearing it from somebody who specializes in OB and GYN.
Okay. Let's see. Okay, this is interesting. Why is there an option? Why is there not an option for antibody testing in place of the vaccine for those that are not deployed and will not deploy as civilians?
Sure. So it's a costly thing, and the frequency in which you'd have to be tested is unknown because it's still being studied. And so for the greater good, there's been no reason or in the research saying that if you have the antibodies that the vaccine would hurt you. So the easier of the two and the most reliable would be to get vaccinated because it's unknown how long those antibodies will last.
Okay. Looking at this one.
How many common medications? Oh my goodness.
Yes. Oh, you want me to read it?
You can read it. Some of that I think I might have to bring back to you. So.
Oh, all right, this is a long one. Okay, Dr. Krause, can you discuss what it means to test using HEK 293 cells and that many common medications such as
Tylenol.
Tylenol, acetaminophen, Pepto-Bismol, Tums, like everything has been tested with on HEK 293.
So I'm going to get back to you because I haven't read all the testing for the Yeah, no, I haven't read it all as it relates to everything that you have listed. But again, if we print off the questions that I don't answer, I'll get that back to you.
Okay. Let's see.
That number's wrong.
Okay, you want to?
Sure.
Okay,
Our data shows that approximately 98% of current infections right now are breakthrough cases of those who are vaccinated. How come? I would ask you where you got that number from, and I know I could pull other information and show that that number is wrong. So we also, we run bed reports through all the states, and CDC does too. And you can get to the site off CDC, and you can see like what the ICU bed rates are and whether or not they were vaccinated or unvaccinated if they're in an ICU bed. And I think that that would be a great place to start for whoever put that question in. If not, I'll send the link to Captain Troy and he can send it out as well. If you follow CDC at all and you read their information, it's great, reliable information versus random posts that are put out there that really look legitimate until you start digging way into them.
Okay. All right. Hey, still trying to get through these. Some of these are kind of long though, so I'm trying to scroll through. And you have a hard stop.
I do. I got about 5 minutes. Sorry.
So sorry everyone. We have the doc is on call, so she's got to do some stuff though. So okay, I think we kind of addressed that.
I think we've kind of get it right. So why should you get the vaccine if you can still transmit COVID? So the chances of you transmitting it get lower as you get vaccinated and we stop new variants from coming. So if your viral load stays low, the likelihood of you transmitting it will be lower. And then those around you, if they get vaccinated, won't get it and you don't have to worry about it, right? So if your family members are eligible to get vaccinated and your whole family's vaccinated, then the chances of you passing it back and forth in case you come in contact at work with somebody who's not vaccinated or they come in contact with somebody at school that's not vaccinated, we're not passing it around our families and sharing and putting those that are not even eligible to get vaccinated at risk.
Okay. And we'll go ahead and just
Sure.
say this as the last question though. So having an autoimmune heart murmur, severe reactions to vaccines as a child, would you recommend a waiver or get a waiver to get the shot?
So I think if you have documented evidence and you can talk to your PCM, then they'll review all that, right? So it's really hard to say or answer the question and say yes or no, just like our previous person that had the questions. So you'd actually have to read the whole person's chart because again, we've had people come in and say they've had heart problems, but come to find out they just stood at attention and they locked their knees, they passed out, but they got an EKG and they assumed that they had a heart problem, right? So if you have that documentation, that can all be put in with your medical waiver, and that's definitely something that we look at when we go through a chart. So hopefully that's helpful. It's really hard to not know your full story to be able to answer that question. But I'm at the clinic and I'm happy to answer questions. I guess my biggest thing, if you're going to come into the clinic and you want to ask questions, that's great. But our staff is kind of the end users. So we're there to vaccinate you or not. We're there to answer questions. But we've had a lot of angry people come in because they're like, I'm being told to get the vaccine. So I'm not telling you that you have to get it, but I am there to offer it because that's our job as the clinic, is to have it available for if you want it. If you want to talk to a doctor, I have doctors that will talk to you. If you want to just chat about the science, if you want to pull research studies, I'm definitely happy to do that and have done that with people and enjoy doing so. Enjoy talking about the different stuff. And if you have a true legitimate research paper you want me to read and you're like, hey doc, have you seen this? I'll read it. I have no problem reading it and checking references and things like that, because I do believe that this will be ongoing for quite some time.
Hey, this has been great. Let's see. One thing I wanted to kind of capture, Stephen, how many folks do we have online today? I can't pick.
We have over 800, sir.
Okay, over 800. So I think this was time well spent for the NAVSE Enterprise. Dr. Krause, thank you so much.
Thank
I think
you.
this was very helpful, and appreciate everything that you're doing. Again, you're doing a phenomenal job here
Thank you.
at the base clinic, though, and really appreciate the expert getting down to ground truth as far
Yes,
as what
definitely.
this everything about this vaccine, as well as the viruses as well. So with that, again, thank you everyone for dialing in. Again, all of your questions weren't asked though, but we will make sure that we capture all of those and get back to you all so you all can see responses from that. This is recorded, so tell your friends that, hey, if you didn't see it, then they will be able to post this and share this later for those that didn't, they may have missed it though. With that, we will sign off and thank you and have a great day out here.